I'm going to start passing over to you if you want to add anything else I overlooked. Thanks, Lizzie.
Great, thank you so much for the introduction, the opportunity to partner on this series, and I appreciate everybody taking the time out of your busy schedules to be here today. This is, as was shared, this is the third webinar in a series of 4. With that, I just want to begin. Here's kind of our agenda for our hour together. To begin with just a brief reorientation to this series and how these webinars will have built upon each other and will kind of culminate in the final webinar that will occur next month. And then also discuss, comprehensive cancer control programming in a rural context, and then describe some best practices for developing goals, objectives, and strategies, and particularly focused on including rural-specific baseline and target measures for goals and objectives. So I know many of you working with cancer coalitions, with comprehensive cancer control programs within your states, or nonprofit organizations, or public health departments, you all are very well versed in developing goals, objectives, and strategies when you develop strategic plans or other types of similar documents. So I don't share this as a as anything that's probably super new to all of you with regards to these key aspects of planning, but I do want to just put it in the context of thinking about rural and including rural in comprehensive cancer control plans. So with that, the objectives for today is to become oriented to the development of rural relevant goals, objectives, and strategies in the context of the most recent notice of funding opportunity for the Comprehensive Cancer Control Program. So those of you involved in your coalitions or when your state programs, I believe this was the funding was applications were due the end of last calendar year. So anyway, I'm just going to revisit some of those things that were in that notice of funding opportunity and how those elements within that call for funding can tie into this in a rural context. Then some best practices for goal, objective, and strategy development. And again, incorporation of rural specific data. As I said, as part of the agenda, that's just restating these as our objectives and things that my goal, my hope for you all in walking away with this can be something that is helpful for you. Anyway, so that is our objectives today. And then those kinds are more learning type objectives versus the types of objectives we're going to talk about today when we think about very action oriented, how do we address the cancer burden within our states and our coalitions. So this is just a kind of outline of the different webinars we've had over the past few months. Starting off with, one focus on defining and describing rural communities and what kinds of data sources are available. And this is something we're going to revisit today because those data sources can be really helpful in identifying, baseline measures and help, develop target measures when we think about having measurable objectives. And then most recently, we had a webinar focused on building partnerships to support rural cancer control. I was really fortunate to have some folks from Iowa and Illinois to describe how they have done that very well in making those partnerships and connections and engaging rural communities. And that's a really important part too when we think about setting rural focused goals, objectives, and strategies, is making sure that the people most affected and the people most knowledgeable about those communities can be a part of this process, and it can be an inclusive process. And then next month, we will have a webinar focused on identifying and implementing evidence-based strategies for rural cancer control, which will, I think, segue well from what we'll wrap up today's session with in thinking about strategies and how those can be implemented and what are some examples of ways those have been implemented successfully. So just to give a little bit of background again for the impetus for this series, so really this focus on rural inclusion and comprehensive cancer control planning emerged from a recommendation from the National Advisory Committee on Rural Health and Human Services, a report that they released a few years ago. And one of those recommendations that they made was that the CDC requires states, territories, tribes, or tribal organizations to consider rural-urban mortality disparities and, as appropriate, develop and implement rural-focused goals, objectives, and strategies in those areas with high mortality. And so that's really the impetus of this work. And so kind of just a little bit of more background, it just became something I was interested in exploring, just with some experience I've had in being involved in some planning processes in the past, is to look at how have plans done this already. And so this was an effort that was led by a couple of students at the University of South Carolina and University of Iowa who did most of this analysis, working with myself and a couple other faculty members to do a content analysis of all the plans that were on the CDC's website as of January 2020. And I just want to show how rural has been included in these past plans. And we can see that more frequently things like just some kind of rural element being included, or having a description of rural disparities, or having some data on the cancer burden in rural. That's something that was occurring, fairly frequently. But we see just a little bit to a lesser extent, the more action-oriented items around goals, objectives, and strategies. There's an opportunity to continue to build upon that as appropriate. And that's something I think is really important to think about, just because, we see that only two states may have had a rural specific goal, and only four may have had a rural specific objective at the time of the plans that were on the website over 2.5 years ago. And this is obviously an evolving thing as you all update your plans over time. But there's certainly maybe an opportunity to see, is there a chance or a avenue for which rural specific goals, objectives, and strategies would be appropriate, and then included in the plan to do a better job of addressing any disparities in cancer mortality. And so those are things that jumped out, and I think hopefully this can be helpful to think about some ways to include these in your planning processes if that is appropriate and makes sense for your state, and the voices of your coalitions and what the data reflect for your state. So I just want to revisit some things in the Comprehensive Cancer Control Program funding announcement that I think are just relevant to think about as we continue on the discussion of goals, objectives, and strategies. And so I'm going to pull from a few of the strategies. These are strategies within the Notice of Funding Opportunity, again, just to orient us to how data can be used and how goals, objectives, and strategies can be developed. So one of the strategies from this funding opportunity was the use of data for program planning to revise and update plans, and to select program priorities and set program baselines and targets. And so that's something that's really important to do, and I know that you all are doing already. This is just an encouragement to think about, selecting strategies then as another kind of sub-strategy within this that prioritize rural or geographic isolated communities, other populations, or geographically determined communities, or people that are most affected. So this can be looking at it from a kind of dichotomous, rural versus urban in your state, or it can be, recognizing, identifying there are regions within your state where there's a particular need, and maybe targeting efforts around that region. And that could be, mostly rural region, or that could include kind of a mix. And then also including cancer registry leadership and efforts around data, and just to provide that important information that can help identify populations or geographic areas in need. And in a similar vein, using surveillance systems and population-based surveys to assess burden and inform programmatic efforts. And this funding announcement also describes, using data to identify and collaborate with populations and geographic locations to identify the greatest burden, and then also guide selection of those tailored interventions that can increase likely these populations of focus can have strategies geared towards them. And then another strategy, and this is purposeful. There wasn't in strategy 3, there wasn't a specific rural lens for that, or geographic lens. So that's why there's a little bit of a break between those two. And then strategy 4 is to deliver screening and implement evidence-based interventions. And this gets to kind of where we'll segue into the final webinar that will occur next month. But I think this is important for us to set the stage in thinking about goals and objectives, so that we can understand what strategies or interventions or approaches can be most effective. And those can be short-term types of objectives that are focused more around improving awareness and knowledge, and more educational types of objectives that then kind of pave the way for improving behaviors, improving screening, and as an intermediate step, then leading to the long-term kinds of objectives or focal areas around reducing disparities across risk factors, incidence, morbidity, mortality that can occur in certain geographic areas like rural, and that cut across population characteristics, just gender, race, ethnicity, and other characteristics. So I think it's also really important to think about not just rural as a homogeneous monolith, because it's not. We all know that in our states, that it depends on where you live, of course, to an extent, but there are certainly some intersections between rurality and race, ethnicity. So many states that could be thinking about the cancer needs of tribal organizations that live in more remote, isolated, frontier kinds of areas, and making sure that that geographic isolation and then historical and contemporary discrimination, exclusion that can occur, that's both being addressed head on. And there might be some, looking at some particularly in the South, where there's rural and Black or African American populations that are more prevalent, and making sure that those intersections and those needs are addressed, or the increasing proportion of Hispanic populations throughout the United States, and particularly in the Southwest, but also even, we see that here where I'm at in Iowa, where that's a growing population in rural areas, and is the fastest growing population in the US, and that includes rural population. So making sure that we address those long term as well. And then strategy 5 talks about creating performance measure plan to report short, intermediate, long-term outcomes, as referenced in the previous slide, along these different areas around screening, prevention, adoption of evidence-based interventions, and all of these things here noted here, in making sure that there are ways to measure and monitor those things. As the saying goes, we can't change what we don't measure. So it's really important to have those metrics, and talk about specific metrics and data resources that are available for us understanding rural needs within our states. So I'm going to talk a little bit about best practices for developing goals, objectives, and strategies, as well as a little bit on tactics, because that's another kind of part of the framework that is sometimes used. Again, recognizing that you all are very well versed in this, hopefully this is just putting it in a context for specifically including rural. So again, this is going to be just maybe some review, but there might be some ways we can think about this again and begin to think about it in the rural context. So, a goal, we want that to be a broad, high-level primary outcome. What is the thing you ultimately want to accomplish? So that could be something like decreasing cancer mortality in rural counties. That's a very high level, that's a broad, that's their ultimate goal. And there are things that can happen to help advance that goal or meet that goal, such as objectives. And that's really where you take that measurable step to improving. So if you think about cancer mortality, perhaps it's something like colorectal cancer, for which screening can be a really important tool for detecting and diagnosing a cancer at an early stage, and making sure that people get treatment in a timely manner. And so that objective might then be to help meet that goal. So this is, in some ways, these are nested within each other. You have a goal, you have a tactic to help you address a strategy. That strategy helps you meet that objective, and that objective helps you meet the goal. So objectives are going to be a very measurable step towards improvement. And we'll talk more specifically about objectives in a minute, but that's, something like increasing screening a certain amount among rural populations within 5 years. So there's that time element as well. And then strategies are also high-level plans to achieve that goal. And this is, implementing cancer screening awareness programs and targeted at rural counties or communities as an example. So that, again, it gets to some of those maybe short-term approaches. We want to see the awareness grow so that people then will get screened, and then that will lead to that reduction in the mortality. But in order to implement that objective, you might have specific action steps that you're going to take. And so perhaps it's determining which media would be the most appropriate for a rural focused awareness program, whether that's using, social media, whether that's using, different types of billboards, ads, radio ads, or maybe it's not the type of platform. Maybe it's, what cancer champions can you engage? Is there somebody who has, developed a really strong rapport with the community, or is just very well respected, and having them involved, that can maybe make that awareness campaign more effective. But that's a tactic you want to take to implement that strategy that lead to changes with the objectives and ultimately the goal. So one of the things that I want to reference, and this is something noted within that notice of funding opportunity, is this idea of S.M.A.R.T.I.E objectives. And this is just an expansion of maybe what we're very familiar with of SMART objectives. And I'll recognize, though, that I've seen this acronym. There are different words for the SMART part. So this might look a little bit different, but hopefully this is still helpful. So obviously you want a very specific objective, that it's concrete, it's detailed, and it's very well defined within the coalition or your program's goals. So you have something that you're really aiming to do, that it's very clear, and it's measurable. I think that's a really key thing. So you have to make sure there are data available to measure the objective, not just at baseline, but that data are sufficiently available to be able to see if you meet that target. So it needs to be measurable in some way, and it needs to be measurable in a way, if we think about a rural specific objective, we need to make sure there are data available for that rural community you're interested in, or rural within your state more broadly. And you want to make sure it's attainable or achievable, that you have the resources, that is something that you can do with available or potentially available resources, recognizing, of course, that there's not many funds or any funds specifically from the Comprehensive Cancer Control Program for things like implementation, but are there opportunities to meet these objectives from other sources, whether it's state-specific funding or grants that are available for different organizations within your coalition to pursue programs, or to implement interventions, or to pilot test interventions. And so that's something you can keep in mind, with that. So those are important things. And also relevant, making sure it's aligned with the goals of the plan and the coalition. You do want that to be aligned very well. And you want it to be time bound. So you want it to be something you can measure within the 5-year plan. And again, that gets to making sure you have the data available at regular, sufficiently regular intervals to assess progress and make sure it's measurable. And then it's some other key components, this idea of being inclusive and equitable. So I think it's really important. This kind of ties into the previous webinar about being inclusive of rural partners, and especially those who may be traditionally excluded. So it may be, it's going to maybe be easier for all of us to connect with rural health systems or our state office of rural health. But I know, previously there were some questions about, how are migrant workers, included, or, other populations whom we might not include as frequently. Is there a way to make sure that all voices are heard or engaged? And then that also ties in with this idea of making sure that the objectives are equitable, that it seeks to address injustices or inequities or oppression, or there's things that can help address those inequities in some way. I think those are really tied together, making sure, it's inclusive and equitable are really important. Obviously, if you have something that's focused on inequities such as, rural urban inequities or racial ethnic or socioeconomic, that there's that element within there. But I think it's also taking that a step further and seeing, are there things that can be addressed more specifically. Oops, did I go the wrong direction? Here we go. Okay, so I just wanted to share a few examples of some states that have done this in the past. This might be some of your states, and there's obviously, this is not an exhaustive list of examples. I just wanted to pull some out to help us see what this may look like. And so, for example, Washington State in a previous plan had a goal of improving access to quality, affordable, and integrated healthcare that incorporates routine clinical preventative services and is available in rural and urban communities alike by effectively and strategically partnering with the healthcare system. So this was a broad overarching goal that was aligned with their coalition, with their program, and included rural. This isn't one necessarily that it was specific to rural, but it definitely, noted that, it wasn't just urban. It wasn't also just this, okay, if it's available throughout the state of Washington, and there's not that, but there's still that inequities between rural and urban, that, this is really indicating, okay, we need to think about the fact that both rural and urban communities have access to these services. And then within this goal, nested within that, they had some corresponding strategies that focused on increased awareness and engagement about community health services and promotion and adoption of evidence-based preventative services. So it's a really good tie-in with some of the strategies from the Notice of Funding opportunity. It's very much aligned to have those corresponding strategies to that goal. As far as some specific examples in the state of Arkansas, this is from a previous plan. They, had this time bound, by 2020, increase the number of women living in rural communities who've received breast cancer screening and diagnostic services and appropriate treatment. So this indicated, it was measurable in a sense that, they could look at an increase in rural. They didn't necessarily have a target post noted, at least within this document, but that's something it is measurable. You can look at who's getting screened, who's getting appropriate treatment, and they had some corresponding strategies to this. Developing a specific screening and coordination plan, ensuring access to services through transportation grants, and then also making sure that rural hospitals and clinics had the equipment to do breast cancer screening. And so again, this ties into having these SMART elements. It was specific, it was something that could be measured because it had that numeric component, attainable in the sense that, while there wasn't necessarily a target, you can look at, did this increase or not? That an increase is something that's relatively attainable, and that makes it realistic. And then of course had the time sensitive element by noting a certain year that they want to look at this. An example of a rural focused strategy here noted is in Kentucky, which is expand continuing medical education opportunities regarding treatment guidelines through increased programming, distance learning, teleconference capabilities in rural areas throughout the state. So this is a strategy that corresponded to a certain set of goals and objectives. So the goal being to promote access to an appropriate utilization of quality cancer diagnostic and treatment services. And so one way that they, and also, sorry, the additional objectives around Commission on Cancer treatment disparities for breast and colorectal cancer. Those are the objectives, and the way to meet those objectives is to make sure that the clinical staff and practitioners had sufficient continuing education around those important treatment guidelines to help meet those objectives and that goal. So those are just, again, just to provide a few examples. So as you're thinking about this for your respective coalitions and plan, there's a couple of things just to keep in mind for each kind of element: goals, objectives, and strategies. Stated, a goal is very high level, and so there's some things to think about with this. Is it sufficiently high level if it's focused on one population group? So that's something to think about. You can see with the one example that particular goal included both rural and urban populations. So there may be situations in which you may not have a rural specific goal, but you might have a rural relevant goal by including rural and urban, and recognizing that you need to look at those in different ways. There might be situations where you may not have a rural specific or rural relevant goal, and you may then try to address rural in the objectives or the strategies. I think it's perfectly acceptable, and it makes sense, given a variety of factors, to maybe not have a rural goal, but to address it in a different way. And there's ways to think about this. If you're wanting to look at some data to help understand that, is looking at how you're defining rural is important. Maybe it's not so much rural, it's a geographic targeting of a specific area of your state. And do you have data to support the need for that rural specific objective that corresponds? And then again, as I said, it might be situations where an objective may be more relevant than a goal. And so rural specific or rural relevant objectives, I think there's important things to consider with this. One of the things that we've, I shared in the first webinar in this series is, data sources. And there may not be the data available to have a baseline measure or targets and follow up and trying to evaluate how well the state moved towards that objective. And so that's something that's important. Is there the type of data to make that rural specific objective measurable, and what's also a reasonable target? So for example, Healthy People 2030 has some specific cancer objectives, and this is linked here. So you can look at those and see, what is reasonable, what kinds of things, what kinds of amounts of improvement make sense. And you could see, what have they found that's made sense? Is it, a 5% improvement, is a 2 percentage point improvement, et cetera. And how might this be achieved with the available or potentially accessible resources that I mentioned before? That's really important to think about with objectives. And how are rural partners included in the process? That gets to inclusivity and equity. And, again, the importance of potential intersections between rurality and other identities, race, ethnicity, socioeconomic status, et cetera. And considering when developing these rural specific objectives and baseline targets and measures, I just want to talk a little bit about that data element, or how we think about some of those things. So when we think about cancer burden, that's probably going to be in the realm of our overarching goals that we want to achieve. And then so oftentimes maybe our objective is going to be focused more at a different point in the cancer continuum, things like screening or prevention, socioeconomic factors, workforce, et cetera. But we can also see that perhaps, screening and behaviors could be a goal or objective. So I'll walk through these just as some examples here in a moment. Okay, sorry, I think I might have gotten these a little bit out of order than I intended to. So, my mouth got ahead of me. All right, so assessing the need for rural specific goals. Again, I talked about it more broadly, but I think I pulled in some of this discussion earlier. So as part of this process of determining if your state or your coalition wants to have a rural specific relevant goal, you do want to take a look at state cancer registry data. The NCI has state cancer profiles, or you might want to look at vital statistics around mortality, just to get a sense of what's going on in your state. Are there cancer types where rural inequities are particularly striking? Are there particular counties where inequities are particularly, there's stark differences? And again, would that broad goal with a corresponding rural targeted objective be more appropriate, or is the goal appropriate, and are the rural and underrepresented voices at the table as part of this process. Okay. And then I'm going to talk a little bit about, ensuring that rural objectives are measurable. So one of the ways is, what kinds of data sources can we look at with regards to screening? And I will note that if you weren't able to participate, the recording from the June webinar that talks about data sources, and then an article on the website that has a bunch of these links to data sources are accessible. I have them linked in the slides here, and they're on the GEO website as well. But we look at screening, and there's some data sources like the Behavioral Risk Factor Surveillance System data, state cancer profiles that would have the data available to look at, rural areas of your state or specific counties within your state, and have both baseline estimates and, sufficiently updated data to assess that. The CDC Places data is another resource that has county, zip code, and census tract level estimates. I put that this is potentially a resource because this is a fairly new resource, and I don't know how frequently they will be updating that. But that's still one to keep on your radar as potential things. So, particular objectives might be just to increase rural colorectal cancer screening by 5 percentage points by 2027. So, have that objective where it's specific, it's measurable, time sensitive, et cetera. You're looking at, inequities. We think about rural, and hopefully in this process you've engaged, included appropriate partners. And then you have, a baseline measure that you're referring to as an example. When we look at, prevention, there's a lot of other sources. Again, these are similar to what I mentioned, but there's also ones around HPV vaccination. And so you may have, objectives focused on vaccination initiation, improvements within that, improvements in smoking rates in high smoking rural counties. So it doesn't necessarily like a rural urban dichotomous. It could be looking across counties, and perhaps maybe the average baseline rate is 20%, and this is, a 33% decrease is what you're looking for, not percentage point, but just, percentage overall. So that might be, some examples of what we might see that are rural specific. I do want to note there might be some other sources, other rural relevant objectives as reflected in some of the examples I shared earlier around workforce, access to care, addressing cancer relevant social determinants of health are really important as well. And so those are some objectives you might be interested in exploring. I do want to also note when we think about rural specific or rural relevant strategies, and thinking about, is there an evidence-based intervention or strategy that may address a relevant objective? And so I did want to share a few things here. The community guide, as you may be familiar with, has specific types of interventions or strategies. Sometimes those are used interchangeably, that work for different types of cancers screening. So client reminders is recommended for breast, cervical, and colorectal cancer. We can see though that, for example, group education is shown effective and recommended for breast cancer, but not for cervical or colorectal cancer. And we can see those other, across the board, there are differences here. And so that can be something that you can, develop then as a strategy, to maybe, engage clinics to implement some of these types of interventions or something of that nature, and as an example. And also NCI has some examples of evidence-based cancer control programs and how those have been implemented at community and policy and clinic levels that you can access as well. And a key thing to think about is, are there potential resources or partners who may be able to implement these strategies and programs? So those are really important aspects in thinking about what kinds of strategies that you develop in your plan. And I do want to note too, is kind of no, we're just noting that the next webinar is really going to focus on some specific examples, have some other panelists sharing of how they have worked to implement some of these evidence-based strategies in rural settings. I think that'll be really interesting, hopefully informative in that upcoming webinar next month, and sharing, you know, how people done colorectal cancer screening in rural health clinics or other types of services. So I think that hopefully that will just give a clearer picture and more specific picture. And I do want to end with that, but certainly want to entertain and engage any questions that people have. Please put that in the question Q&A box, or happy to answer those at this time. So please do that, or yeah, please use the Q&A box, or you can also please feel free to reach out to me at a later time. Happy to try to other information or clarification or resources, and whatever might be helpful for you all. So thank you very much for your attention. And I'm, again, happy to answer questions you may have. Please feel free to put those in the Q&A box. Oh, sorry, I see one here. That's yeah. So somebody asked a question about updating our cancer plan that suggests adding rural objectives throughout or making a specific section. That is a good question, and you know, I think it can be either way. I can see it advantaged, and I've seen examples of that done in different ways. So some states, you know, the last webinar we had, someone who was involved in developing the most recent state of Illinois plan, and they had a rural health section within their plan and addressed that very specifically. And they had that with different types of populations that experience inequities. And so they had, you know, some information based upon race or ethnicity, or sexual orientation, or other, you know, population groups, and they had specific sections on that. So I've seen that, and I think that's been effective, but I also have seen it where it's interspersed throughout. So I don't necessarily think there is a right or wrong to that. I think, you know, what makes most sense to your coalition as far as having a separate section, or, you know, having that interspersed might make it where it's, you know, potentially where it comes to mind for other people who may not be as, you know, if it's in a separate section, that could mean people who aren't as interested in, you know, flip past that section. So I could see pluses and minuses to both. Yeah. Okay. Any thoughts on objectives around reaching rural populations with tailored public awareness campaigns? There's been a lot of pushback that this is not an evidence-based intervention. That is an excellent question. Because that is the balance of of things, because that is something that can be easy to do. I mean, that's something that you can, in some ways, measure the reach of something. If you think of different frameworks of getting that, you can measure, you know, how many flyers or postcards you sent out, or those kinds of things. And so that sometimes can be attractive. But, you know, there is, you know, evidence perhaps that, you know, this, it's not that it's making, you know, reducing screening or reducing things, but it may not be. So I think it is an opportunity. I think it's something to potentially do, but if there are ways to do things that are evidence-based, you know, that is, you want to lean towards that, but sometimes, you know, doing something is, you know, might be, I don't say it's better than doing nothing, but that's a really good question. I wish I had a stronger answer for that. You know, I would recommend as much as possible, you know, doing some more evidence-based approaches, but you know, if there are ways to do that, and that's a way to engage rural communities, I think that could be, you know, effective. And I think, you know, one thing I will say that I've found with, you know, some of the community guide recommendations, I think they're wonderful, one thing that I remember reading with some of the papers that have been written, the systematic reviews that inform the community guide around screening, for example. I mean, this paper is 10 years old now, but it's the most recent one that they've used, is that, excuse me, sorry about that, is that they've noted that these interventions have not necessarily been tested in rural settings. So you have that balance of, yes, these may not be, certain things might have insufficient evidence to show that they're effective, but they also haven't been tested in rural communities as frequently. So maybe in rural communities they are effective. So that's, I think that's something to think about. Again, I'm definitely supportive of as much evidence base as we can do. But there is that caveat, is that some of these things have not been tested as frequently in rural communities. So we may not have that specific of an element. Okay, so I see one in the chat. Very large area that's not very populated. You have a budget. Yeah, that is a really good question, because the budgets are small and geography is large. One thing I'll note, just with some work I've done when I lived in Illinois myself, is that there was a coalition or network, sorry, of health coalitions in Southern Illinois, the Healthy Southern Illinois Delta Network, and we did some work with them, and they were formed by some network grants from HRSA, and I know that's like a long-term strategy, or broader strategy beyond cancer, but I think that can be effective to try to see if there are ways within a large geographic area, because this is that was the southernmost 16 counties in Illinois, which is fairly large. Well, I think it was the size of Connecticut and Rhode Island combined geographically, but it was very sparsely populated, and that was something that was affected for them. I have heard just anecdotally that the pandemic, in some ways, by making things more accessible through webinars or other things, that might necessarily directly tie to some of the things that you might have needs for, but sometimes maybe just the shift to doing things more virtually might save on some costs for travel or other things. So that does run into things like broadband access in rural areas and other barriers, but yeah, so that's probably, I'm sorry, that's not a great answer to that question. I think that the funding challenge is a really big one. And I think as much as we can, advocate for more funding for things like this program, it would be helpful, especially from the evaluation implementation realm, or seeing if there are other sources of funding that may be accessible. Yeah, so there's another question in the Q&A about, are there any EBIs or promising practices you recommend as an objective to utilize for rural populations? So one thing I would note, I noted that some of the community guide, the things that inform the community guide, haven't all been tested in rural communities, but the evidence-based practices for cancer control on the NCI website, if you click on that link, you can filter by population group or setting, and they do have some rural specific examples of implementing some important evidence-based strategies, and so that might be something to take a look at. The Rural Health Information Hub is a website. I don't think I linked it in this particular webinar slides, but yeah, that website has a lot of promising practices, evidence-based interventions that are specific to rural. That might expand beyond solely more direct, specific cancer things, interventions, but that'd be another resource. So I would note that the next webinar, I know we'll have some folks who have done this. They can share some more specific things around what's worked in different settings, like rural health clinic, Medicare certified rural health clinics are a big, I think just an enormous opportunity to engage them and some of the things that have worked there with some of the small media efforts or provider reminders. They had some innovative ways they did some provider reminders. I won't spoil that from that presentation, but hopefully that gives a little bit of a partial answer. Let's make sure okay. Sorry, I'll take a look at the chat here to make sure that, yeah, thank you, Ikra, for putting the Rural Health Information Hub link in there. See if there are anything else that I can, a couple other questions. Okay, one other. Issue with implementing EBIs, especially in rural settings, is that we aren't the ones actually implementing the EBIs, and they are not always willing to share data needed for metrics or have the bandwidth. Thoughts. That is a good question. So one thing, that is, think about that a minute. Yeah, I think bandwidth is, a big challenge with data sharing. Even federal FQHCs, for example, they do have requirements around quality assurance and collecting quality metrics around cancer screening. But often, EHR challenges or the bandwidth of getting that data is a challenge, and that's even more so a challenge for rural health clinics who don't have that requirement. So I don't know, so maybe some thoughts are, as much as possible, engaging those individuals in the process as early on, as you develop those objectives and strategies, and as they implement those, and maybe if they're, feeling more engaged, they might be more likely to share that, or, there are some data available on HRSA's website on specific FQH, and I don't want to assume this is an FQHC, but there are data sources available that you can pull on, specific FQHC grantees to see how are they measuring up with their metrics. So you can look at that at a state level. Again, that's probably not the most complete answer, but I think, as much as to engage those folks who may be a little bit hesitant, maybe that, makes them feel more comfortable, or recognize, you're just educating with them how this helps, inform, statewide initiatives, or if there's, something that can be, shared with them or provided with them, if there's some kind of dialogue or interchange of information that might make them more likely to share that information. I know that is a real challenge with that. So I wish I had a stronger answer, but hopefully that helps a little bit. But thank you all. Thank you for the great questions. And I hope to the upcoming webinar that we'll talk more about implementation of these interventions and strategies. I hope that will maybe get to some of these a little more fully. I don't mean to kick the can to October, but I think it'll hopefully, the answers I've given or some of the information today can help provide that foundation for additional discussion next time. Yeah, and we'll make sure. Yeah, I'll send these slides to Ikra and the GIA team to share on the website, and the other two webinars are available for reviewing. The slides are available. I'm happy to try to answer questions if you have follow-up questions later on. The link.
I can I have that link actually with me right
great.
now, so I can go ahead and share that real quick.
Thank you. Yeah, we have the date up there and the time. Yeah, I think that'll be a really interesting one that will again have have some good panelists, and I think you won't just have to listen to me that time, but it'll be, I think, just some really good information. But let me see, are there any other questions or comments that folks have? Again, I really appreciate all the engagement and the good questions, and really appreciate the work that you all are doing in your respective states to address the cancer burden in your states.
Well, thank you so much, Dr. Zahn. We really appreciate you sharing your work and your insights. And thank you to all the webinar attendees for your participation and your great questions. So just stay tuned for the post-webinar email that will go out this week. It'll have a registration link for webinar number 4, which will be on October 26th. And as a reminder, we kindly ask you to complete the evaluation survey, which will be included in there as well. And I pasted it in the chat. So thank you again for joining us, and we hope you have a wonderful rest of your day.